Hey everybody, we wanted to send you this video. We've had a lot of questions about the Shockwave based on some emails that I've sent out and at Facebook. So now that we kind of have it up and running and almost ready for patient use, wanted to go through a little bit more specifically, kind of answer a couple of the most frequently asked questions, and kind of more importantly is like, what is it and how does it work? So what the Softwave machine does is it shoots a high frequency acoustic sound wave, all right, through the applicator that we apply over, the body part or the area of injury or concern. And by doing that, what it helps to do is it breaks up scar tissue. It's been shown to increase blood flow for up to 300% for several days to weeks afterwards. And then really the secret sauce is that it releases a component called exosomes, which are inside your body. And what exosomes do is that they signal your stem cells, which are the master repair cells of the body, to migrate to the area of the injury to create a repair process. So how it works is we can set the intensity and the frequency based on the body part, and there are very well established treatment protocols for the specific body parts or specific diagnoses. So typically it's done about 8 to 10 visits over the course of about 4 weeks, and we start at 2 times a week for a couple weeks, and then eventually get down to once a week. And then what happens is that really the vast majority of people notice some level of immediate improvement. We've had kind of working on myself. Dr. David's knee got radically better. I worked on a friend's ankle over the weekend, and he hadn't been able to run for a week, and he went out and ran 10 miles a couple hours after he had this. So it can work very quickly in terms of the effectiveness, but the main thing is that it will create that stem cell migration to happen to the injured body part for the next 6 months. And so again, while there's immediate improvement, most people can notice range of motion or like less pain within one visit. Really it's the healing process that takes place. So that was one question that I got, was, is this something I need to keep getting done? And technically not really. Its effectiveness will be what it is, and then as long as you're not battering or bruising or re-injuring that area, it should work very well. So it does work for chronic issues, meaning issues you've had a long time ago and just kind of ongoing nagging issues. It also works for acute issues as well. So people that are in car accidents, or if you sprain an ankle or sprain a knee, or maybe even injure a disc in your neck or your back, this machine can be used on the spine as well. Lastly, with this, we're not ready for this, but we're working through some aesthetic type protocols. So meaning like ways to help your face or certain cellulite or skin look better naturally as well, which is pretty great. So the best part about this is that it's really pain-free. There's no needles, obviously there's no cutting, no surgeries, none of those things there too. And it actually stimulates your body to heal versus just kind of covering up the symptoms that traditional orthopedic care or even physical therapy care might do for those joints. And then lastly, it's way more, not only more effective, but it's also cheaper and more cost effective than getting PRP shots, or certainly than getting stem cell therapy or stem cell injections as well. So while it's really equipped to take care of a wide variety of conditions, it's especially effective at things like tendinitis, golfer's elbow or tennis elbow, osteoarthritis in knees, shoulders, hips, ankles, really any joint of the body. It's also great for tendinopathies, so things like maybe Achilles injuries. And then finally, there's also components for neuropathy as well. So if there's nerve damage, or whether the issue's going on in your feet or in your hands, TMJ, right? It's great for all kinds of issues too. So if you're curious about learning more about that, we're gonna have a couple of informational sessions to kind of go through the science and use some pretty pictures and all that a little bit more specifically later this week, as well as next week. So you'll see a registration link for one of the 2 days if you want to come to that. And then from there, we'll walk through like, what does a first visit look like? We call it the discovery visit. And then what might a treatment protocol look like in terms of cost? Because it does vary, but we'll kind of be able to give you somewhat of an idea for that, and how we're going to really make this very flexible and affordable for everybody to do that really wants to get this done. So that's it in the Softwave, and you can watch on Facebook too, as we'll show other people getting taken care of and treated, so you can see how they improve and follow their journey along as well. So have a good day.